You're listening to C103's Cork Today podcast. Phone and text lines are currently closed.
To the Health Hub store, Times Square in Ballincollig, where Anneliese joins me this Monday afternoon. Good afternoon, Anneliese.
Good afternoon, Patricia.
And you are very welcome. Let's get straight into questions. Could Anneliese recommend what supplements will be the right supplements to take for somebody suffering from rheumatoid arthritis? That's from Marie.
Okay, well, specifically for rheumatoid arthritis, which is an autoimmune disease that attacks the joints in the body and damages the cartilage, you would be needing to go from two approaches. The first is to take something to support the immune system, to try and rebalance it. Now, there's supplements that are very good for that. The fish oils particularly are quite good for that. But there is one particular fish oil that has been formulated, and I've seen brilliant results with it here in clinics in the shop. It's called Nutri Advanced Opti Resol, OPTI Resol, RESOL, and it's kind of for resolving inflammation. I'd often give that to people at the beginning to try and bring inflammation down very quickly. And then I'd put them onto a general fish oil for long-term kind of immune support. It helps to rebalance the overactive side of the immune system that's attacking the body. So definitely that is one I'd recommend. And I think a vitamin D supplement. People with autoimmune diseases, Patricia, often need a higher amount of vitamin D for some reason. But the best thing to do really is to get your blood, get your vitamin D checked in your bloods, either with your doctor or buy a vitamin D testing kit in your local health shop and check where you are so that you know how much to take so you're not overdoing it. But a lot of people that I would come across would need at least 3,000 units of vitamin D daily and taking it all year round. And then you're looking at something that would support the joints. And again, we get great feedback on UC2 cartilage. It's a particular type of cartilage that's very good for kind of maintaining and rebuilding the cartilage in joints. It comes from chicken, and it's a particular kind. It's the type 2 cartilage. And the product we use here is GAL UC2 cartilage. And then finally, the last thing I'd say is something that's a good anti-inflammatory. Now, if you're maintaining and if you're not if they're not swollen and painful, you may not need it, but you could always start taking it if you felt they were starting to, get painful again. And natural anti-inflammatories include boswellia, which comes from frankincense, actually, and the other one is high-potency extract of turmeric, which is called curcumin. And you'll find a lot of supplements that have high strength of either or both even mixed together. So you could take that to manage the inflammation rather than depending on the anti-inflammatories from the doctor.
Okay, this is a text. I kind of go, ouch, when I read it. Listener said, I got a wisdom tooth taken out. It was about 3 weeks ago, and I ended up with a dry socket after a week. I'm still a bit sore. Is there anything that Anneliese could recommend to help with the soreness? Oh, that is agony.
It is very, very sore. I mean, really, it's about healing. To be honest, Patricia, I'm only pulling this now out of the air. I think something like coconut oil might work very well. You need to make sure that your hands are very clean when you're applying it. But coconut oil has got lovely oils that are very good for sort of moisturising skin, but also it has got something in it called caprylic acid naturally that is a natural antibacterial and antifungal. So it would be very good to kind of prevent further infection or and speed up the healing. And then I always think for healing, you take it to heal from within side out. Vitamin C and zinc is great for healing any kind of skin or tissue, muscle, broken bone. They're all both of those are very important. And in actual fact, the nurses in the hospital, when I broke a bone in my foot recently, they told me to take vitamin C. So they're even telling you to do that in the hospital for broken bones. So you can get a vitamin C and zinc supplement that will come together. I know that Viridian do a very good one, but there's lots of them you'll find in your health shop. And that'll speed up the healing from the inside out.
Okay, Mary is taking mega magnesium. She suffers from restless legs. She often takes a magnesium tablet on top of the mega magnesium. She wants to know what is the recommended amount. How much magnesium should she really be taking?
Well, you see, I mean, I'm a believer in you only take things as you need them. So I don't think it's a good idea to take high doses of everything in the long term unless you actually need it. So if she does need to take that much to keep the restless legs at bay, then I would recommend that she takes one lot at night time. So that way it would have the benefit of helping with restless legs at night, but it wouldn't be interfering maybe with absorption of other nutrients throughout the day. Particularly it does compete with calcium. So, it's like it's always risk versus benefit, Patricia. So if you're getting a great benefit from something, it's worth maybe a small risk of it possibly interfering with calcium absorption. You might also feel that it might make your bowels a little loose, but that might be worth it to put up with the restless legs. But something she could try, which is very simple and completely free, is actually to start doing stretching. And the other thing is to be make sure you're well hydrated. So drink plenty of water, and you could also put a pinch of sea salt or Himalayan salt into the water to make sure you're getting all of your electrolytes in balance. But those two free things actually make a huge benefit to people with restless legs. And if you go online onto YouTube and just look at, Google stretches for restless legs, you'll get a huge amount of them on YouTube that you can just see and copy.
Okay. Maureen says, could you give me advice, please, for frequent urination and also an increase in muscle cramps in my legs? I developed them while on holidays recently, but I've been drinking lots of water to avoid dehydration. Much appreciated.
Yeah, so it is kind of common, all right, Patricia, that people would get very swollen on holidays. I'm not entirely sure what it is, why it is that some people get it and others don't. I think it might be something to do with the lymph, because if you get fluid that leaks out of your blood vessels into surrounding tissue, it's your lymph system that is responsible for getting that back into circulation. And maybe if your lymph is sluggish, it's very hard for you to actually get rid of that kind of swollen and puffiness. And it's only a theory of mine. I'm not. Yeah. That's the scientific reason. But so I think to support the lymph would be very important. Restless legs can be a lack of electrolytes. So if you were drinking a lot of water, maybe you were depleting yourself of electrolytes. I would definitely recommend, if you're on holidays drinking lots of water, to put a pinch of salt into the water, because that way you're getting the electrolytes in with the water, so you're not likely to deplete yourself of those. And then in terms of supporting the lymph, there's various different herbs that are very useful. Dandelion, burdock is very good, artichoke is very good, any of those bitters. And you can buy a dandelion and burdock tea, or you can take a supplement that will actually have a combination of those in there that's specifically kind of designed for water retention. I think we've one in the shop here called Hydro Out, and it's a few things in there for that. So that's good for the puffiness. But exercise, the lymph doesn't have a pump like the heart to pump it around. It's actually your body does it. So yoga stretches and walking and just stretching and exercise will help move that lymph as well.
Okay, a caller's been on to say, could you please explain what carpal tunnel syndrome is?
So carpal tunnel is where you get a build-up in the nerve that runs down the arm to your hand, and it builds up sort of around the wrist area. It can be as a result of many different things, Patricia, but I think repetitive strain is a big factor. So people who would be using their hands a lot for work or kitchen or, just generally using their hands a lot. So what happens is that build-up kind of impedes the nerve, and you get a lot of numbness and pain going into the hand because the nerve signals aren't going down properly. So you can have surgery for it, and it's very successful, very, very successful. There isn't really anything natural to take to get rid of carpal tunnel syndrome. But the one thing I would say is that it's not always carpal tunnel, because I know myself, I would have been a typical carpal tunnel person, but actually the nerve was being trapped at my neck area, not down further on. So when I got I went to a chiropractor, and when I got that sorted out, the numbness in my hand disappeared. So it wasn't carpal tunnel at all. So make sure that it's not actually, the nerve isn't getting trapped up further on. If you think it could be coming from your neck, go to a good chiropractor or for a good physical therapist that will help release out that nerve, and you might avoid your surgery.
Can you suggest a multivitamin that this listener can take that doesn't have iron in it? Listener says, I'm borderline hemochromatosis, which we did an interview on last week, the amount of people with hemochromatosis. And of course, the first thing they reach for is, because they're tired, they reach for something with the iron, and it's the worst thing you can do. So are there a lot of multivitamins without iron?
There isn't a lot of them, but there are some. And luckily, the Source of Life Gold, if you ever need a tonic, doesn't have iron in it. So that's one without iron. The Revive Active Zest Active is a nice multivitamin that comes in a sachet form. That doesn't have iron in it. And I think, the OptiU, it used to, that's another sachet product that also doesn't have iron in it. So they would all be suitable. And if you go into any health shop, they may have different versions. But those three, the Source of Life Gold, the Revive Zest Active, and the OptiU, they're all iron-free.
Okay, and I'm wondering, because I can see there's 2 or 3 questions in with the same complaint. Is it the Source of Life Gold? You're still saying for people recovering from COVID, still a lot of COVID out there. There's a bit of a summer wave at the moment, and people saying survived COVID, it was fine, but I'm very, very tired following it.
Absolutely, and the 100-day cough as well, Patricia, is wiping people out. So it's not even just COVID. I think there was a couple of very nasty viruses around in the last month or so we've seen coming into the shop. So the Source of Life Gold, I just don't think you can beat it for a tonic. I really don't. It's got so much in it to support your immune system and for energy, as well as a full multi and loads of superfoods. But I mean, unfortunately, and some people do get long COVID. Fatigue is a major factor with long COVID. Again, this is only my theory, but I do notice as people who would have led very, very busy, stressful lives, it seems to affect them even worse. So it's like they were always on the knife edge, burning the candle at both ends, and then the virus just wipes them out. So, just be patient. For most people, it really should clear up in 4 to 8 weeks afterwards. And if it doesn't, then go and speak to your doctor about long COVID. But you could definitely take the Source of Life for 2 months, no problem. And if you really do need something extra to get you through the day, ginseng is always a lovely way to give you a bit of an energy boost without getting kind of jitters like you'd get from depending on caffeine.
Okay, hi Anneliese. My very small toe is very painful. Red, it's like a burning sensation. I went to the doctor who sent me for an x-ray, but nothing showed up. The pain is cruel and it hurts really badly when I'm walking on it, just in my small toe.
I don't know, Patricia, really. Could be anything, couldn't it?
Yeah.
I mean, an x-ray, I think, will only show if there's
something
a broken bone.
Yeah.
So, I mean, you could have pulled a tendon in it. Did this person knock it? Did they bruise it? Did they twist it? Is it that they're wearing the wrong footwear? It could be their gait,
Could it be gout?
Gout? It could be gout, but like a doctor really should pick
We'd pick that up, yeah, that's true.
And gout tends to be more in the big toe. But it could be gout. I would say that's the least likely. I'd say it's more likely than that something has been pulled or you're possibly something wrong with your gait. A lot of people would get, that could be the start maybe of plantar fasciitis, where the pain starts moving up through the muscle in the foot. So maybe go to a physiotherapist because they will be able to categorically tell you what it is. I think if it's definitely not a broken bone, it's probably something muscular or tendon.
Okay, and finally, Chris is on. He is about to head in for a hip replacement in the near future. What would you suggest to help him prepare so that his recovery will be better? And when should he start? Whatever you're going to advertise, or what you're going to recommend? When should he start before the operation?
So, well, now you have to be careful when you go in for surgery about certain things because they can thin the blood. So if you're already on taking things like fish oils and turmeric, you need to stop those about 10 days before you go for surgery because of their blood thinning properties. So I think the main thing before surgery is to make sure your immune system is in good shape because you don't want to go in and catch something in there when you're depleted anyway after a surgery. So I would recommend taking a little something to boost the immune system. I love the elderberry complex that we sell here. We sell buckets every year, but there's lots of them. Nature's Plus do an immune support and immune boost product that have everything in there to support your immune system. So I would take that for going up into surgery and then have ready to begin after surgery for healing some vitamin C and zinc and some arnica, homeopathic arnica. Now again, you can take these before surgery, but you can start them as soon as you're out of surgery and that will really speed up, particularly the arnica, will really speed up the healing of all the muscles that have been, cut apart and torn. So that's what I would suggest. Okay.
All right. Listen, have a lovely week and we will chat to you again next Monday. That is Anneliese Dressel of the Health Hub Times Square in Ballincollig.